Hi, my name is Erica Lepore, and I'm a naturopathic doctor. I moved to Rhode Island in 2000, and I opened up a private practice in Wakefield. I also, at that time, taught my 21-day detox class. I love Rhode Island, and I'm very happy to live here, although it wasn't a state that licensed naturopathic doctors when I moved here. But in the last few years, we have been able to obtain a license through the Rhode Island Department of Health. And now, if you're a naturopath in Rhode Island, if you call yourself a naturopath, then you have to have passed national board exams and gone to a 4-year accredited university, which I did. So that's very exciting. And because of that, I decided to go back into private practice. So I'm now back in private practice. My kids are a little bit older, not so interested in hanging out with me anymore. So I'm able to spend some time really taking care of my patients as well. However, I love my 21-day detox plan. I've been teaching it for 20 years. I did it for the first time myself when I was a student at Bastyr, and I have obviously modified it since then. But it's a wonderful program that helps people achieve their health goals in as little as 21 days. So if you're motivated and disciplined, then it's something that everyone can do. The diet is really easy. You're allowed to eat as much of the allowed foods as you want. There's no deprivation. There's no nutrient deficiencies. I read about like pros and cons of detox on the internet, and the cons are always you're in the bathroom all the time. You're not in the bathroom all the time. There are nutrient deficiencies because you're depriving yourself, or you're only drinking water, or you're doing just juicing, but you're not. This diet is, you're allowed a lot of food, all of the allowed foods, as much as you want. There's so much nutrient density. You could actually live on the diet for the rest of your life and be completely fine. Sometimes, because people do feel worse before they feel better, that's very common. The first few days can be really uncomfortable as you're weaning off caffeine and sugar and wheat. All of those foods can cause the same kind of pleasure sense in your brain that that certain opioid medications do. So weaning off of them will actually be painful for some people. Some people have like muscle aches or a headache, or they're just fatigued, but it only lasts for a few days. But I always tell people that you really don't want to quit, because the only way to really feel better at this point is to go through it, because you're not going to just start eating sugar again. Like, nobody on earth is going to tell you that that's a good idea. So you have to really stick with the diet, and you'll get the results that you're looking for. So I don't think that aging, normal signs of aging include like joint pain, or thinning hair, or headaches, or like just fatigue, or just discomfort in our body, lots of aches and pains, because I've seen plenty of people. My clients are all ages, and the older you are, the better you feel on this diet. The young people are like not so toxic, so they pretty much feel the same. But the older you are and the more life you've lived, the better you feel. And if it was normal for aging to feel uncomfortable and to be in pain, then people wouldn't get better on this diet, and they do. So naturopaths believe that your body has an ability to heal itself, that nature can cure you and your body can heal itself if the obstacles are removed. So what are the obstacles? Well, that's what we're going to figure out together in the 21 days. There are so many obstacles. They're all different for different people. You have to be your own health detective. I'm going to guide you. We're going to look at food sensitivity. So are you sensitive to gluten? We're going to look at your environment and see if there's things there that could be improved. Like maybe you're burning a lot of Yankee candles. Maybe your indoor air quality is poor. Maybe your job is exposing you to toxins. Maybe you're eating too much sugar. That's a big one. Really easy to do, since 600,000 products in the grocery store, 80% of them have added sugar. So very easy to eat too much sugar. So that's something we're going to look at. We're going to look at nutrients. Like 45% of people who are Americans are deficient in magnesium. So that's a nutrient that we're going to try to add in and really think about. It's important for detoxing hormones, important for detoxing other toxins from your body, and it's really great for about 100 other things. So that's a really great nutrient to really focus on. So I'm going to talk about other nutrients that are helpful for detoxification that you may be deficient in. So we're going to look at all areas. I really try to cram it all into one program without having to give you all an honorary degree in naturopathic medicine. I am just trying to give you as much information as possible. But one thing you could do now as you get ready, if it's something you're interested in doing, is you could wean yourself off coffee. I find that people who are already off of caffeine before they start the program feel a lot better in the first few days than those who are quitting cold turkey. So I usually advise people to wean off by going from a full cup of caffeinated coffee to half decaf, half regular, and then 3/4 regular, 1/4 decaf, and then completely decaf. And then there is no coffee allowed on the diet, so then you would have to give up coffee completely, but you could wait until the very last day to do that. So even though I think I joke around that this is like the pre-tox, which it definitely is in December, most of the time of the year we don't want to take that too far. But I don't think any of us can completely avoid that in this month. So, but if you have been pre-toxing, then you might want to consider weaning off of caffeine before you start. And then if you're not going to do the plan, but you're just looking for some tips on how to stay healthy, a couple of areas that I like to ask people to explore are where there might be added sugar in their diet that they don't know about. So like I said, 80% of the products in the grocery store have added sugar. So unless you're reading the label of every single product you buy, and the 20% that don't are really the ones in the produce section. So you really need to read labels in order to avoid added sugar. So you don't want to have any sugar or sugar-like substances. So they'll hide sugar by calling it evaporated cane juice or cane crystals or dextrose or apple juice concentrate, although that's not so bad, but all different names for sugar. So you have to really look at it to see, like glucose is on there sometimes. So you really need to read the label to look for sugar. And often it's there more than one time on the ingredient label. And you really don't want to be having food that has added sugar unless it's a brownie or a Christmas cookie or your child's birthday cake. Yes, like then celebrate, eat the sugar, no problem. This isn't an all or nothing lifestyle. This is just, in general, you want to reduce the amount of added sugar in your diet. So that's something you could do. Really increase your hydration. I found that a lot of people come to me and all they really need to do is drink more water and take a magnesium supplement at night, and they feel really, really good. So those two interventions can be very helpful for a lot of people, especially if you have headaches or you're constipated or you're achy or you can't sleep or you're anxious. The water and magnesium are really helpful for those conditions. If you're looking to do some deeper exploration into your health, then the 21-day detox is really the way to do it. I will guide you and give you a ton of attention. Anyone that's done it before knows that I am very, very responsive, and I give a lot of outside help, and I will help you reach your health goals, whether it's within the 21 days or it takes a little bit longer. I'm very committed to helping people to reach their optimum health. So if you don't remember what it feels like to feel well, then this diet might be the one for you, because it does remind people. I've had people say to me, I haven't felt this way since I was 18, or I thought I was going to have to live with that pain my whole life. Like I didn't know what that nagging feeling was, but it's gone. So all sorts of really fun things happen to our bodies when we give them an opportunity to heal. And I'm going to support you on that journey.